So most people think of Alzheimer's as a condition rooted solely in the brain, but recent research suggests that the gut, the digestive system, might be more involved than we ever realized. So what is exactly the gut microbiome? Well, it's a complex community of trillions of microorganisms living in our digestive tract. This includes bacteria, viruses, fungi, and other microbes. And while they help with digestion and nutrient absorption, their influence doesn't stop there. So these microbes produce chemicals that affect our immune system, our metabolism, and even our brain function. The communication happens through what's called the gut-brain axis, a two-way communication network linking the central nervous system with the gut via neural, hormonal, and immune pathways. So think of it like a superhighway, constantly exchanging signals between your brain and gut. Now here's where it really gets interesting. Recent studies using advanced imaging have shown structural changes in the guts of mice with Alzheimer's disease. Researchers observed abnormalities in intestinal cells, nerve fibers, and even in the mucus that lines the intestines. What's more, these mice exhibited increased inflammation not just in their gut but also in their brain. This suggests that an unhealthy gut may trigger systemic inflammation, which can cross the blood-brain barrier, which is kind of the protective shield of the brain, and contribute to neurodegenerations. In humans, similar patterns are emerging. Studies show that people with Alzheimer's tend to have less diversity in their gut bacteria and higher levels of pro-inflammatory microbes. This chronic low-grade inflammation might accelerate the buildup of amyloid plaques and tau tangles, which are the hallmarks of Alzheimer's. So what does this mean for us? Well, understanding the gut-brain connections opens up new possibilities for both preventing and treating Alzheimer's. Imagine using probiotics, prebiotics, or even dietary changes to modify gut health as a part of Alzheimer's therapy. Now, it's really important to remember it's early days and these findings are very preliminary. That said, there is growing evidence that diet plays a role. Diets rich in fiber, fermented foods, and omega-3s seem to promote gut health and may reduce the risk of cognitive decline. While we don't have all the answers yet, and we're not ready to prescribe probiotics as the way to prevent Alzheimer's or to treat Alzheimer's, it's becoming increasingly clear that taking care of your gut health is very important in taking care of your brain health.